Introduction. Lungs are a pair of respiratory organs which occupies most of the space in the thoracic cavity. Lung invaginates the corresponding pleural cavity. Lungs are spongy in nature. At birth, the lungs are pink in color. In the young, the lungs are brown or gray in color. As the inhalation of carbon particles increases, the lungs become black in color, more so in smokers. Right lung weighs around 700 grams, about 50 to 100 grams heavier than the left lung. Features. Each lung is cone-shaped. It presents apex, directed upwards, base, directed downwards towards the diaphragm on which it rests, borders, anterior, posterior, and inferior. Surfaces: costal, and medial. Medial surface includes vertebral and mediastinal parts. Apex. Apex is directed upwards. It lies above the level of anterior end of first rib, but below the level of its neck. It is about 2.5 centimeters above the medial 1/3 of clavicle. It is covered by cervical pleura and further by Simpson's fascia. Medially, apex is grooved by subclavian artery. Base. Base is directed downwards towards the diaphragm on which it rests. It is semilunar in shape. It is concave and rests on diaphragm. Diaphragm separates left lung from left lobe of liver, fundus of stomach, and spleen. It separates right lung from right lobe of liver. Anterior border. It is sharpest border. It is shorter than the posterior border. Anterior border of right lung is vertical and corresponds to the costo-mediastinal line of pleural reflection. Anterior border of left lung shows a wide cardiac notch below the fourth costal cartilage. The part of the left lung below the cardiac notch is known as lingula. Posterior border. It's an ill-defined, thick and rounded border. It extends from the C7 to T10. Inferior border. Inferior border. It separates base from medial and costal surfaces. Costal surface. It is is named so because this surface is related to the ribs and costal cartilages separated by costal pleura. Medial surface. It is divided into anterior mediastinal surface and posterior vertebral surface. Vertebral surface is related to bodies of vertebrae, intervening intervertebral discs, posterior intercostal vessels, and splanchnic nerves. Mediastinal surface of right lung. Mediastinal surface of right lung is related to right atrium or auricle, small part of right ventricle, superior vena cava, right brachiocephalic vein, azygous vein, esophagus, inferior vena cava, trachea, right vagus nerve, right phrenic nerve. Mediastinal surface of left lung. Mediastinal surface of left lung is related to left ventricle, adjoining part of right ventricle and left auricle, pulmonary trunk, arch of aorta, descending thoracic aorta, left subclavian artery, esophagus, left brachiocephalic vein, left vagus, left recurrent laryngeal and left phrenic nerves, thoracic duct. Fissures and lobes of right lung. Right lung consists of two fissures, horizontal and oblique fissures. These fissures divide the right lung into three lobes, upper, middle, and lower lobes. Left lung consists of only oblique fissure. Hence, it has two lobes, upper and lower. Oblique fissure cuts the whole thickness of lung, barring the hilum. It crosses the posterior border about 6 centimeters below the apex, passes downwards and forwards, and crosses the inferior border about 5 centimeters from the median plane. Horizontal fissure of right lung passes from the anterior border up to the oblique fissure at the level of fourth costal cartilage. It meets the oblique fissure at mid-axillary line. Do remember that the number of lobes and fissures are variable. Right lung may have only 2 lobes. Left lung may have 3 lobes, and many accessory lobes might be seen. The presence of fissures allows easy expansion of lung during inspiration. Root of lung. Root of lung connects the medial surface of lung to the mediastinum. It is formed by the structures entering or exiting the lung at the hilum. Situation. Root of lung is situated opposite the bodies of 5th, 6th and 7th thoracic vertebra. Contents. Root is made up of eparterial and hyparterial bronchus on right side, one principal bronchus on left side, pulmonary artery, superior and inferior pulmonary vein, 2 bronchial arteries on left side, 1 on right side, bronchial veins, pulmonary plexus of nerves, Bronchopulmonary lymph nodes. Areolar tissue. Arrangement of bronchus and vascular structures varies on right and left side. From before backwards, it is similar on both sides. Superior pulmonary vein, pulmonary artery and bronchus. From above downwards on right side, eparterial bronchus, pulmonary artery, and hyparterial bronchus and inferior pulmonary vein. From above downwards on left side, pulmonary artery, principal bronchus and inferior pulmonary vein. Blood supply of lungs. Arterial supply. Lungs are supplied by bronchial and pulmonary arteries. Bronchial arteries supply nutrition to the lung tissue. Pulmonary artery carries deoxygenated blood from the right ventricle, which is oxygenated in the lungs. There is precapillary anastomosis between the two sets of arteries, which enlarge when one of them is obstructed. Bronchial artery. These are small arteries, one on right side and two on left side. On right side, the single bronchial artery arises from the third posterior intercostal artery or sometimes from upper left bronchial artery. On left side, the two bronchial arteries arise from descending thoracic aorta. Venous drainage. Venous drainage from most of the lungs is carried through the pulmonary veins, which finally opens into the left atrium. There are two pulmonary veins on each side, superior and inferior. Part of the venous blood, especially those draining the first one or two divisions of bronchi, enters the bronchial veins. There will be two bronchial veins in each lung. Right bronchial veins drain into azygous vein. The left bronchial veins drain into the hemiazygous vein. Lymphatic drainage. Lymphatics of the lung are arranged in two sets, superficial and deep. Superficial vessels drain the peripheral lung tissue, that is, the tissue that lies beneath the visceral pleura. The vessels traverse the borders of lung, reaches the hilum and drains into the bronchopulmonary nodes. Deeper vessels drain the bronchial tree, pulmonary vessels and connective tissue septa. They reach the hilum and drain into the bronchopulmonary nodes. Nerve supply. Sympathetic nerves are derived from thoracic sympathetic chain carrying fibers from T2 to T5 segments. These are inhibitory to the smooth muscles and glands of bronchial tree. Parasympathetic nerves are derived from vagus. These fibers are motor to bronchial muscles, secretomotor to glands of bronchial tree. They also carry sensation from the bronchial tree and responsible for stretch reflex, cough reflex.